Here we presented use of a double balloon overtube with endoscopic snare for ESD at the right column preclinical trial. This is our COI. More than 25,000 colectomies for benign polyps are performed each year in the United States. We believe that many of them would be unnecessary. What are our roles? First, we need to know the right indication for endoluminal treatment and need to acquire the right skills. We think what is most important is to advance the endoluminal treatment. Today, we will show an endoluminal interventional platform using a novel traction method. Here is double balloon endoluminal interventional platform, what we call DEIP. This is an overtube device with two balloons. We can move four balloons beyond the endoscope tip to create a therapeutic zone. DEIP can improve navigation, stability, and visualization, and provide a conduit for additional instruments. This is our traction method using DEIP. 3-0 silk loop was tied around the colonoscope at 12 o'clock. Once circumferential mucosal incision was completed, the endoscope was pulled out. An endoscopic snare was passed through the silk loop and held by biopsy forceps through the endoscopic channel. The endoscope with the snare and the forceps were reinserted through the sheath. This is the ESD procedure video. We advanced the endoscope with the snare and the forceps to the region. The distal margin of the region was lifted through the snare by using the biopsy forceps and grasped by tightening the snare. Pushing or pulling back the snare provided good traction. Submucosal dissection was performed using ESD knife. We can regrasp the tissue to obtain better traction if needed. This function enables clinicians to keep good traction until the end of ESD procedures. This traction method was evaluated using 3D ex vivo model and fresh porcine cones. 3 cm lesions were created at different locations: transverse colon, hepatic flexure, and cecum. We compared 3 different ESD techniques: standard ESD technique, ESD with DEIP, ESD with DEIP, and Snare. We collected these outcomes such as procedure time, injection volume, number of muscular injuries. Grasping time was defined as the time from pulling out the endoscope to grasping the tissue. These are ESD outcomes at the transverse colon. Grasping time was 4.6 minutes in DEIP and Snare group. DEIP and Snare group had much shorter dissection time and total procedure time than other two groups. In addition, DEIP and Snare group had fewer injuries compared with standard group. We did subgroup analysis of the anterior and posterior regions at the transverse colon. These are outcomes for the anterior regions. Dissection time was significantly shorter in DEIP and Snare group. These are outcomes for the posterior regions. For the posterior regions, additional advantage of the DEIP and Snare group showed significantly shorter total procedure time and fewer injuries. This is summary. Grasping time was 4.6 minutes. DEIP and Snare group had shorter dissection time and total procedure time than other two groups. DEIP and Snare group had fewer injuries than standard group. These differences were more significant for posterior regions. Next, we performed ESD procedures at different locations. These are ESD outcomes at the hepatic flexure. Grasping time was similar to at the transverse colon. DEIP and Snare group had much shorter dissection time and total procedure time than other two groups, but there was no difference in number of injuries. These are ESD outcomes at the posterior wall of cecum, which were very similar to at the transverse colon. DEIP and Snare group had much shorter dissection time and total procedure time than other two groups. DEIP and Snare group had fewer injuries compared with standard group. We compared outcomes of DEIP and Snare ESD performed at different locations. Procedure times were similar in the three locations, but more injuries were noted at the cecum compared to at the transverse colon. Finally, we performed ESD procedures of 4 cm lesions at the transverse colon. The lesion was regrasped once for all procedures to keep good traction. DEIP and Snare group had much shorter dissection time and total procedure time than other two groups. This is summary. 120 ESD procedures were performed at different locations. Grasping time was about 5 minutes regardless of locations. DEIP and Snare group had shorter dissection time and total procedure time than other two groups. DEIP and Snare group had fewer injuries than standard group at the transverse colon and cecum. As for ESD of 4 cm lesions, the ability to regrasp the lesion enabled faster removal of bigger lesions. There are some limitations in this study. This is conclusion. This traction method with DEIP and the Snare could remove large lesions in the right colon faster and with fewer injuries. New techniques and devices may contribute to lower colectomy rates for complex polyps.